Advanced search and the MeSH strategy, how it is done. And let's begin. I will have to share my screen for that, and I'll make sure that everyone follows what I'm talking about. And we will be really, really fast. And I want everyone who is watching, make sure you practice it this many times that you become an expert, and it's on your fingertips, and you should be doing it that fast as well. So let's begin. Let's begin. And I will share the screen. Now my screen is shared, and I will start with the document, Word document. So let's open a Word document. This is the Word document, and I open my Word document, and let's say that's my systematic review, and my phase 1 is planning, phase 2 is search, and phase 3 is the writing. So we will make sure that the font is really visible. These are the 3 phases, right? So we are talking about phase 2 now, because planning is already done and I have decided my research question. So my research question is, for example, do Parkinson's patients who take benzodiazepines do Parkinson's patients who take benzodiazepine develop anxiety in the long run? Okay, so that's my research question. So immediately when I see my research question, let's say I have already decided my research question, and this is my research question, and now the situation is that I have my question ready. Now let's talk about how to move through the next step. Next step is the search strategy. So let's do the search strategy and see how fast we will do it. Search strategy. In the search strategy, I need to divide my research question into concepts. So how many concepts do I have in my question? Remember, this concept is a name. It's not like the concept as we say, oh, you improve your concepts or the basic of your study. No, this is something else. This is not that concept. This is a concept terminology we use in systematic reviews. So what do we mean by this? We will divide our research question into concepts. Concept number 1 is my Parkinson's patients. Concept 2 is my benzodiazepines. Anxiety is my concept 3. So I have 3 concepts in my question. So my concept number 1 is Parkinson's. My concept 1, and I'll change the color so that you can see that this is concept 1. My concept 2 is benzos. And my concept 3 is anxiety. Sorry, forgot to copy it. Okay, so that's anxiety. Okay, so phase 1 is done. Phase 2, now we're on phase 2, and on phase 2 we are on our search strategy, and we cannot start search strategy without the concept. Now we will start our building block approach. What does that mean? That means we will decide the keywords, and we'll start with PubMed always. Keywords, and the next thing is MeSH. So we will have our keywords and MeSH strategy for each concept one by one. So let's start with concept number 1. Concept number 1, we will first find their keywords. Concept number 2, we will find the keywords. Concept number 3, anxiety, we will find the keywords. Now, how do we find the keywords? How do we find the keywords? That's a challenge for many people, and people are scared of it, right? So let's talk about how easy it is. I'm going to give you a shortcut. You will remember me forever for this. Okay, so now we have divided into our question into 3 concepts. Concept 1 is Parkinson's or Parkinson's disease or Parkinsonism or Parkinson patients. Concept 2 is benzodiazepines. Concept 3 is anxiety. Now, first thing first is to decide the keywords. And these keywords will be decided for PubMed and other databases that I will use. And in the phase 1, I already decided my databases, right? You always decide your databases in phase 1. In this session, we are talking about just phase 2. So phase 1 is done, and I already decided, let's say in my mind, I have already decided, and I have written it down, that PubMed will be my first database. That means Medline, PubMed and Medline. You cannot differentiate. So Medline, PubMed, PubMed Central, Web of Science, Science Direct, and last one will be Google Scholar. So I'll use 5 databases, so I know. So my keywords will be the same keywords for all 5 databases. But my MeSH strategy will not be the same for these databases, because MeSH strategy is not used by every database. Medical subject heading, we call it as controlled vocabulary, controlled vocabulary. Don't ever get confused that what is controlled vocabulary. Controlled vocabulary is another term for MeSH. MeSH is the name for controlled vocabulary in PubMed and Medline, of course. But any other databases, when you go outside PubMed, you go to usmle and those databases that use MeSH, you don't call them MeSH then. You call them controlled vocabulary. So now, let's move forward. So I have my keywords, Parkinson's, benzodiazepines, and anxiety, and I have my MeSH, Parkinson's, benzodiazepines, and anxiety. I'll find my keywords and MeSH for these 3 concepts. So we start with Parkinson's. So what are the keywords for Parkinson's? Simply search the synonyms, 5 or 6 synonyms, just 5 are okay, of Parkinson's, and that will be your keyword, or that will be your keywords. Those will be your keywords. Now I'm showing my screen again, so we all know what can be 5 possible keywords of Parkinson's. First one is of course Parkinson. Second one is Parkinsonism. Third keyword can be bradykinesia, right? Everyone knows this. Bradykinesia. Rigidity. That can also give me some papers related to Parkinson's. And what can be the 5th one? Movement disorder. Okay, I could have brought so many other things, but 5 is enough. I don't have enough time. So you can say just we'll focus on 5. So yes, you can focus on 5. That's fine. So these are my keywords. Congratulations, our keywords are decided. Now, benzodiazepines. What are the keywords? First one will always be benzos, right? Benzodiazepines. Second can be alprazolam. Third can be midazolam. Or that's how midazolam. Fourth could be something else. Anxiolytics. And remember, this question is strange because these are anti-anxiety medications, right? And we are seeing if they develop anxiety in the long run. So that's a kind of strange question. So benzodiazepines, alprazolam, midazolam, and anxiolytics, and that's enough. Let's say 4. Now anxiety. So how do I find synonyms for anxiety? Cell phone. This is very important. Go to your cell phone, everyone, and go to your, if you have Apple, go to Safari, or simply just go to Google search engine, whatever you are using. If it's a Samsung phone, if it's Android, or if it's iPhone, just go there and type anxiety. Although I know synonyms of anxiety, we can have tremors, we can have another synonym as worry or nervousness, but I just want to see if we search on Google, what will come up? Anxiety synonyms, worry, concern. Look at this now. So Google showed me some keywords. Anxiety, of course, the first one will always be anxiety. Worry, concern, apprehension, and what else? Generalized anxiety disorder, GAD. So I got my keywords. So now I have my keywords, and now these keywords will be used for PubMed and other databases, all other databases. I have my keywords ready for all databases, but MeSH is only for PubMed, only for PubMed or Medline. Same thing, because PubMed is an interface to Medline. So before we move forward, let me see what other people are saying. Okay, everyone is typing and giving me suggestions. Lorazepam, yes, I forgot about that. Yeah. Generalized anxiety disorder, panic disorder, absolutely. Can we add brand names of drugs? There's a question. Can we add brand names of drugs as keywords? Well, absolutely. Why not? Absolutely. I would do that. And I have done it before in my search. Like, for example, escitalopram, Lexapro, market name. I do that. So now our keywords are ready. Now let's go to MeSH, and I'll share my screen again, because now we are going to a very, very powerful thing. Now MeSH strategy will be used. So I need to find the MeSH keywords for my 3 concepts. My first concept is Parkinson's. Let's go to PubMed. And I'm on PubMed now. This is PubMed. Everyone can see PubMed. Now, should I just type here? No, I'll scroll down on PubMed website. First of all, log into your PubMed. Create an account. Make sure you create an account. You see my account here with my email address? This is an account. I have logged in to my Gmail. So create an account on PubMed and use your Gmail, and you logged in. Why you want to log in? We will talk about this, because we want to save everything. And PubMed will send us emails about our strategy if somebody publishes a new paper related to our strategy. That's why we need to log in. Don't miss logging in. Now scroll down and you come to the MeSH database here. You see this top right, the bottom right corner. Bottom right corner, this, you see this blinking? Everyone can see this blinking? This is MeSH database. I will click here. It will take me to the next page. Now I am on PubMed MeSH. Look at this. This is MESH. MeSH stands for Medical Subject Heading. It is a controlled vocabulary name for PubMed. Now, my first concept is Parkinson's. So I type Parkinson and I will now search what is the MeSH strategy for Parkinson's. So I noticed that it gave me 2 options. Parkinson's disease or mental status and dementia test. Only two possibilities. PubMed is giving me two ideas that either you can use this or you can use that. So I'll remove everything from my previous search so that you don't get confused. So this is blank, okay? Remember, this is blank, nothing. This is blank. On the top right, PubMed search bar. So now when I search Parkinson, it gave me this or this. Now I have to choose the best one. Common sense, I'll use as common sense. And sometimes while using common sense, if there are multiple options, you can make a mistake, but it's okay. Your search will not be affected that much. So here it's very easy and straightforward. So my MeSH strategy is Parkinson's disease, not Parkinson's disease. See this? Parkinson's disease. Now I click on it. And Parkinson's disease is opened. My MeSH strategy for Parkinson's disease is open. Now I'm looking at benzodiazepines effect. Does it worsen the anxiety in the long run in Parkinson's patients? That's what we are looking at, right? So what I'll do is cerebrospinal fluid. Yes, I want to see papers that talk about the cerebrospinal fluid affects any chemical change in the brain, any complications, yes, do they develop? And I don't need diagnostic imaging. I don't need diagnosis. I need drug effects. I need drug therapy. And I need etiology. No, I need genetics. I do, but yeah, let's go ahead and do that. Okay. I want to see studies that talk about genes as well. And immunology, I don't need to talk about this. I don't need to see this. Mortality, I'm not focused on mortality. So just talk about pathology, pathophysiology, psychology, because you're talking about anxiety and therapeutic use. And that's enough. Too much. Too much. Therapy, I've already used drug therapy, so I don't need to click on therapy. So that will give me a lot of good ideas, good papers that will talk about Parkinson's patients, cerebrospinal fluid, and any complication they are having. So I can find best papers related to benzodiazepine and anxiety if I choose these. So just use common sense. And remember, you can make mistakes. It's okay. It's okay. Your strategy would be excellent, wonderful, but it can never be perfect. We all are human beings. Even I can make mistakes. So don't try to be perfect. It's okay. You can make mistakes. It's okay. The point is that you are recording your strategies just to tell the other scientists that, okay, this is what we did. And they may see, okay, you missed this keyword. So next time when they write a paper, they will add that keyword in there, in their MeSH, if they work on that paper. So it's okay if you make a mistake. So don't be ashamed. Now what do? I will say restrict to MeSH major topic. Or I don't click on it either way. If I add search, here I will get strategy. I'll click on it here. Some people don't click on it. Some people do not want to include anything at the bottom here. So they click here. Do not include MeSH terms found below this term in MeSH hierarchy. But I want this. I want papers related to idiopathic Parkinson's disease, Lewy body, Parkinson's disease, idiopathic. I want these things. So I will not click on it. And I think I should not click here either. So let's see what happens. Now I have a very good strategy, MeSH strategy, ready for my concept number 1. Congratulations. What I'll do is I'll copy paste it. I'll go back to my Word document and I will copy paste it here. And don't get scared. We will reduce the font. We don't want to scare you. Change the color. Now my Parkinson's is ready. Yeah, I did everything correctly. So now benzodiazepines. Let's see the second. Let's see second search. Because MeSH is already selected here, so I don't need to go back and I can just put benzos here. So I put benzodiazepines and I search and I would see what is available for MeSH, and it directly gives me only one benzodiazepine option, and it brings me to the main page. It brings me to this main page. So MeSH, benzodiazepine, but I want to confirm it. I want to confirm it, I want to confirm it. I go here. I want to confirm that I haven't made a mistake. So if I do it again by opening the whole window again, will it give me some options of benzos? So I notice that no, there is only one possibility, benzodiazepines. So we are going in the right direction. So benzos, administration and dosage, adverse effects, I will choose that. I'll choose cerebrospinal fluid is already selected out there, so I don't need to do that. And anything else. I think we have also already mentioned therapy out there. So therapy is already covered. Therapeutic use is already covered. History, etiology, isolation, purification, metabolism, pharmacokinetics and pharmacology. We can add that. Agonist and analogs, antagonist. Let's keep it too simple. We keep it here. And we are not restricting anything. We want everything, anything related to benzos, all types of benzos. See this? All types of benzos. We want everything. So we will not restrict to, do not include MeSH terms found below this term. We do not need that. It could be different for your situation. So always look at it at the bottom. That do you need that or not? If you need that, then don't click on it. If you need that, don't click on it. So I need it. That's why I'm not clicking on on this. And I'm not restricting it to major MeSH. I can, it is okay. But if you don't do it, it will give you broader search. Now, so simple. So simple. Benzodiazepines. And I'll go to my data sheet again. And now I'll change it. Congratulations. Congratulations, your benzos is done and your Parkinson's is done. Now we are on anxiety. Let's talk about anxiety on MeSH. Now my last search, MeSH is already there. Always make sure before clicking that the word MeSH is written here. Otherwise you will be confused at what happened. Now I'll click search. I click search and now it gives me 13 options. Now I have to choose the best one. Now which one is best one? Use common sense, whichever you feel is the best one. You know, 2 of them are best ones. Number 9, anxiety disorders, and number 1. So you can choose any of those. I'll choose this. I click number 1. Because I felt if I choose number 1 or number 9, it shouldn't make any difference because both are covering the same thing. So always remove this here so that you don't mix it. So I'll remove this. Now I am ready for my anxiety. Anxiety as a side effect. Anxiety as a side effect, side effect, side effect, side effect. Is there any side effect here? Adverse effect, adverse effect. We have already written that though by in there. So drug effects, drug therapy. Side effects. Do we see any side effects here? Prevention, control, psychology, sadistic surgery, therapy. There is no side effect mentioned here. Because we have already mentioned it before, so it will still give us a very good idea. It will give us very good papers because of other concepts. We already have that drug side effect in there, right? So drug effects is here, so it should give us the same papers that we are looking for. And what is there at the bottom here? All sorts of anxieties. Okay, do we want to focus on all sorts of anxieties or generalized anxiety disorder? I think just anxiety. So this time we will not include anything at the bottom. Add to search. Now I have, hold on, change it. Now I have chosen both. Just for teaching purposes, remember, I want to show you that it will still give something. Okay? So I chose this, and I'll go back to my third concept, anxiety. Congratulations. We have our MeSH strategy ready. Okay, congratulations. So we have our MeSH strategy ready for Parkinson's, benzodiazepines, and anxiety. These are all three concepts. And we have our keywords ready as well: Parkinson's, benzodiazepines, and anxiety. So now what do? We simply do the building block approach, one concept at a time. So we will mix them together. Yes, we will mix the keywords with MeSH. But how do we mix it? Remember, we cannot just mix it without bringing an OR here, OR, capital, always uppercase. OR, always uppercase. I saw many students making a mistake. They write down OR as small or lowercase. Don't do that. So Parkinson's or Parkinsonism or, and no comma, nothing except this apostrophe. Now, how do I mix them together? I'll bring this Parkinson's strategy either in front or at the bottom. I have cut it. So it doesn't matter if I bring it in front or if I bring it after that. Sorry, here. So I can bring it after that. That's okay. By an OR, again, an OR. Congratulations. This is Parkinson's. Search strategy ready. Now, the next thing, benzodiazepines. I'll do the same thing. Cut it, bring to benzodiazepine. Let's this time bring it in front. But I connected with an OR again. Remember, with the MeSH and regular keywords, we'll connect them with an OR. And here I'll mix them together again with an OR, and OR. Now my MeSH is ready. My strategy is ready. And I'm getting ready for advanced search. Remember this. So this is done. Congratulations. Now my last thing is left, anxiety. And anxiety, I will bring it here. But now where is an OR? I cannot move forward without an OR. And here I have to remove the comma. Otherwise we cannot move forward. Otherwise the data will be wrong. The number of articles will be lesser or more, and you will not have a correct strategy. We don't want that. So now this is it. This is it. Congratulations. Now we have our PubMed Advanced Search Strategy ready. Now we go